quick stare down. Hi, little mama. Oh, there's a escape. Nico. Hello, Nico. Oh. Gotcha. Gotcha. Oops. Hello. Hey, Gordon. I might, because I brought some, steal one of your syringes with a teeny bit of water in it. Okay. Because I brought some dewormers. Oh. But they're pills, so then Novamax, and I figured they haven't probably been dewormed for weeks yet.
No, they have not. Just Stranded and Revolution.
They probably, in some sense, because they haven't had fleas or hunting here, so they probably don't have teeth, but I thought it might be cute if they to be. Why not? Shake it up a bit.
Yeah, that's good. Get you just escaping. Nothing.
No. Oh, you're so shiny.
I know, isn't she? She is magnificent.
Shiny, cute girl.
She likes to flop on your feet. Syringe. Do you need anything else in particular?
I think we should be good. Just syringe with a teeny bit of water stop for me and then.
Okay, got that.
I'm not sure if I brought a thermometer, which would probably, to be honest, should do.
I have thermometer.
Not that I think it's. What are you? Maybe there you go. Okay. Well, I'll do nicer. It's for, I brought, heaven forbid, just in case there's any adverse events.
Oh,
I brought some steroids.
so prepared.
No, I didn't read them.
I have some slightly better than the other one.
And we'll have weights, because
I will scale the beginning.
yes, absolutely. It's a big office.
It's a big office filled with many things. Here's Scampy. We'll probably have the best stuff with this one. Do you have the glue and all that stuff? Okay. I do.
None of that.
I know where my
I'll bring some of the figures. I do have some props. I just even a couple props.
Yeah.
I think because I remember I was debating yesterday whether I should or shouldn't.
that quite 100 times a day.
We have baby gate at the top of our stairs, and that's how Matt broke his ribs.
Really?
Because we always go over and we never open it,
Oh.
and he crumbled.
Oh, that's not good.
I'm gonna go with a spoon.
I don't know where I think I lent out my good thermometer and my good. This one's okay.
Hello. You see, you are on my foot, trying to get my attention.
She likes to do a flip flop.
So cute. Maybe you'll be my pumpkin.
That would be lovely. That would be very lovely.
Do you use for like spring to clean?
Oh, I have a proxy guardian too. Is that okay?
Lovely. Lovely. So where do you want to sit up? You will wait and cast and hold. Is that what we're
Yeah.
doing?
Yeah.
Okay, I'll take this out.
It's right here if you want to.
Okay.
Is that okay?
Mm-hmm. Nice. We get a little system. Would be awesome. Like down here.
Yeah, that would be good.
Which way is the camera?
The camera's over there in the corner. So if you sit like yeah,
here?
if you sit there, that's perfect. I'll try to run into some things. There we
You're coming with a game.
go.
You Dorothy wants in on it.
Oh, she
We
wants
will.
lots of things right now. All right. Do you need anything to put your knee on?
No, I just need to sort. Unfortunately, it's
Okay.
that is okay.
All right. Hello, everybody. Let us know if you can hear okay. You should be able to.
Are you in the cooler bag?
You're very
You.
scampy. Very scampy. Whoops. Uh-oh.
And I will take some notes so that I can go back and put up official, so the people that are adopting know the weight and what was given.
That is very nice of you.
And we have some. Oh, okay. And so we have, and you have your little syringe of water.
Yes.
Somewhere. Awesome. I'll take that. I need to grab one more thing because I have a cheat dosage chart. Whether they're gonna, some of them will get half of a pill, and I bet some of them will get the whole. Do you remember the one?
Yeah.
Depending on their weight.
Probably Marvin. He's a big boy. A big boy. All right.
Anybody a kilogram and below gets a half. And anybody, is there anybody over a kilogram?
I haven't weighed it. I didn't weigh them yesterday, so Marvel might be close.
Okay. So then we'll get all.
Oh, kicks for the baby.
Oh, awesome.
All right.
Oh, good morning.
Perfect. Can you be here?
We have a good view of the blue sky.
No, everyone will look in and wonder what's happening here. Okay, so everybody, this is Dr. Renee Ferguson from Mountain View Veterinary Hospital in Langley, mvvet.ca. She's our awesome vet. She does awesome things to save kittens.
No, it's a pleasure to be here. These guys are awesome. And well, good. We'll do their 8-week checkup, and we're going to do a nose to tail exam on all of them. And we'll do an eyes and ears and heart and abdomen and toes and limbs and teeth and everything. And then if everything is good for all of them, then we will do the vaccines. We're going to do the rhinotracheitis and the cleci and the panleukopenia vaccine, which is pretty much what we call core vaccines, for pretty much give them a good amount of immunity as though they're going to be indoor cats. And then they should be boosted again in a month. They should be hopefully in all their new homes all settled in at the regular veterinarian by then. And we will also give them another deworming, which puppies and kittens should be dewormed every 2 weeks, from ideally 2 weeks of age till 3 months of age. And then it's not going to hurt Dorothy to have some extra deworming because she had parasite load second to none. So we will give her some extra deworming too.
Yay.
Oh, don't eat that baby monkey.
He wouldn't eat solid food until like 2 days ago, and now he can eat the Vaseline. That's good.
Who do you want to start with?
Okay. Well, we'll start with Toto. Maybe we should go in order of the chart. Let's see. Oh, all right. Well, we'll start with Henry because he's first. First on the list. Oh no. He is 920.
Ooh, almost 920. Henry Ray.
Yep.
120 grams. That's a really good weight for 8 weeks.
They have caught up because they were teeny tiny when they were born. They were my smallest litter.
Not anymore, I don't think.
Not anymore.
Come back, Henry.
12. Okay, so that's.
So he's going to be, when we get things ready, he's going to be half of a deworming tablet when we do it. And we're going to use Milbamax. Milbamax will get roundworms and hookworms and whipworms, and it will also get tapeworms. Not that I'm expecting these guys to have tapeworms, because they need to get tapeworms either from being exposed to fleas, and these guys are on a flea prevention, or they need to hunt rodents, which I know they haven't done either, but it's a good thorough thing to do and a nice safe dewormer. Come back, Henry. Henry. You probably can't see the light. So let's start with his eyes. Hi, handsome. Boy. He's actually probably got one of the better eyes, hey? As far as not having the issues of the other. How do your teeth?
Jeez.
Say ah. Good boy. He's got good alignment in his mouth. He won't need braces.
That's
Good job. Just peek in your ears.
Dorothy's feeling amorous.
So far, it's working to her advantage because she's being very friendly, all boys.
Very friendly. There we go.
I'm just making sure no ear mites or there's no evidence of any ear infections. It looks wonderful. You're being great, Henry.
Good job.
Want a piece, Shelly? And there's been no coughing or sneezing.
Nope.
Nothing.
Nope.
No signs of upper respiratory tract infections.
No eye goop.
Good. Lymph nodes are good. Her listen to his hearty. Good job. Oops, sorry. To get my sleeve up to look at the heart rate.
Don't kick. Kick this.
Good boy. Sounds good. It's got nice, clear lungs. So I'm going to just feel his abdomen and make sure that he's got the right size kidneys and liver. I feel your right kidney, and there's your left kidney. Good. Let me feel your tummy. He's got a big bladder. Let me feel his little knees. So, be nice to see. Some dogs and cats have knees that like to not stay in the socket. So we're just making sure. It's called patellofixation. It feels good. Good. You have two boys back there. Have you seen them?
I mean, I haven't tried to feel them.
Success!
Two.
Yay! Two boys back there.
Yay.
Good job, buddy. Good job. So now the hard part. The temperature.
Oh my goodness. This will be his first experience.
Sorry to be so mean. I think it's the right thing to do before they have their vaccine.
That's good.
I know. Everybody will think I'm just awful.
Horrible.
It's the right thing to do.
All right, buddy.
Sorry, buddy. Oh, very good.
What a good boy. This one's kind of slow.
It's okay. And it's in Fahrenheit.
Mm-hmm.
You guys, hey?
Oh. Tail out of the way. She's welcome tail.
Good. He looks really good.
He is a magnificent specimen.
Mm-hmm. Good. 100.8, which is very
and
normal.
Good job, buddy.
Very lovely. Let me just entertain him for a second.
I can do that. 1,262 people are watching. Thanks for tuning in, everyone.
Mm-hmm. And if people have questions, they can certainly ask.
Yeah, put your questions in the chat. I'm not watching 100% of the time, but if you keep repeating it, I'll see it.
When there's a slate. So the vaccine, the rhinotracheitis, the calici, and the panleukopenia vaccine that we're going to give, very safe. And I like to give it over the left shoulder. That's just my habit. Veterinarians usually have a preference. Sometimes we have to, depending on our patient, have to change where we give them. But in general, most veterinarians have a favorite place they like to do it. So if he can face you, Shelly.
So then you know if you give multiple vaccines and you get a reaction in one area.
Or a little lump or a bump. Yeah, vaccine reactions are very, very rare, but they can certainly happen. We are injecting something foreign in there and then asking the body to have an immune response to it. But also at the same time, really important. There you go. You're very good.
Good job, buddy.
So what we'll watch for today is making sure there's no vomiting or diarrhea, swelling around the face. And usually if animals are going to have a reaction to the vaccine, they have it in an acute type of reaction. They have it in the first 20 minutes. But Shelly will, when she's petting them, is just make sure that there's no lump or bump that forms. But I think everything should kind of be nice and nice and uneventful. Let's give you a deworming. These are meant to be meat flavored. Let's see. Is he kind of a? He's not a piggy, hey?
He's one of the. Was the third one to try the food.
Henry,
so.
do you want that one? A snack. It's very yummy. Shelly's own cats just eat things like this.
They think it is a delightful snack.
They do. So I will get the little water. There, put this syringe. I'll put some. Here it is. Okay.
Hello.
So what we're gonna do, because he didn't eat it, is we're just gonna put it in his mouth. Oh, he says, oh. And then whenever you give a cat a pill, always give them just a teeny bit of water or a snack afterwards, because you never want the pill to be stuck in their throat. So that they swallow it and it doesn't get stuck in their esophagus and cause any type of esophageal strictures. Very good. You're a good guy.
No strictures.
No.
Good job. All done with you. All right. Next will be Sleepy Toto.
Really? I'm going to change my ear tip.
Buddy. He is 7:30.
You're wee.
He was the biggest, and then when Dorothy's been doing less milkbar, and I've been trying to get her to wean a little bit, so then he was not gaining as fast because he refused to eat the food until 2 days ago. So he's got a little catching up to do.
He's still not underweight, though. When you feel his body condition, be gentle with me. When you feel his body condition, it's actually still ideal. So it's not that he is undernourished in any way. Good boy. He's got a little bit of that persistent pupil remembering, hey? Around his iris.
Mm-hmm. Yep.
Yeah. And you also want me braces. You have nice alignment. Very good.
He's very handsome. He needs to be talkative.
Let's go. Are you picking your ears, Toto? Come on. Good job. Good job. What? What? Little peep. There are no problems with him either. Good. You feel your tummy, Mr. Toto. Good. Kidneys are good. Liver's there. She's hilarious.
I know. She's quite the...
Okay, what do you think? Are you up to it? Oh, actually, let's check your business. Let's stop it. Very rude. I might need him at somehow a teeny bit more still. Think we're good. Yay! Good boy.
She's very graceful when she exits, like me. Okay, buddy. Here we go.
Sorry, sweetie pea. Oh, I know. I know.
Oh my goodness, so brave.
It's all Shelly's fault.
So brave. I know, now he's looking at me with the eyes. The tiny betrayal.
What a good boy. You coming back? It's more excitement in here, huh? It's nice to have a big, gigantic window to look at.
I know. They have enjoyed that. Oh, bud. What do you think, Mama?
100.6. That
Perfect.
is also a perfect temperature.
Perfect. Good job, buddy. That means you have won yourself a vaccine.
Let me write it down because when I'm typing this up in an hour and a bit, I will not remember 100.6.
Yes. Nor would I. The chat might remember for us. It is a slow thermometer. I have a faster one, but it's not accurate. So that's why I use the slow one.
Yeah. We do have some 10-second ones at the clinic too, but sometimes it's only a piece of little bit of inexpensive technology. So sometimes if they're slow, or too fast, I don't trust them either. Like,
Yeah.
how'd you get that number so fast?
I've actually tried it twice and then I get two completely different numbers. Are you gonna come see us again though tonight? Oh, not quite high enough.
Okay, and we also get 0 kilograms. You will get the other half of the deworming tablet.
Oh, that belly.
Would you just eat this, Toto? Would you just eat this little snack right there?
I would be impressed if he eats it.
Very yummy. She's thinking about it. She says, I'm thinking about it.
Oh, that helped. Tail in face.
Boy. A little bit of water too. Good boy. There, okay, let's do your vaccine in your left shoulder.
Plop. Does it go in muscle or skin?
Subcutaneous, so under the skin, above the muscle. Intramuscular injections, sometimes we have to do them, not often with vaccines at all, but they don't feel good. So usually with vaccines, I would say that the patients don't even know. If you have somebody or petting their head or a treat, they just do awesome.
Good job, buddy.
He was very good.
You were very good.
You were a rock star also.
Good job. We will do coffee next.
Do you agree? We get a black one.
Chili, yes. 685.
Well, you're we. I can tell who I might see next week now.
I know. There has been a very distinct.
Ozzy 685.
He's too busy playing. Some of them are too busy playing to eat. And Toto didn't want to eat.
Have this for a second.
She really likes that. It's her favorite.
The ophthalmoscope?
Yeah.
Hello, handsome.
And now he gets bites and kicks.
So what these kittens have, Shelley's probably talked a little bit about it. They'll have it to a little bit of a degree, is something called a persistent pupillary membrane. Whereas when kittens are fetuses and they were inside Dorothy, every single kitten, and it's normal, has a membrane over top of their over top of their pupil, and then as they when they're born, that membrane is broken down. These guys, some of them are a little bit slower than average with the membrane breaking down, and some of them it's quite it's quite prominent. And Shelley and Dr. Henderson, who I work with, got an ophthalmologist to check because sometimes abnormalities in the iris can also mean significant disease. And the ophthalmologist, which is a specialist, somebody who went to school for 3 to 5 years longer than me, and just looks at dog and cat, or primarily dog and cat eyes, thought that it's not going to affect these guys in any way. So I'm just making sure that it continues to look good. It's not a very common condition at all. Trust tiny kittens to come up with something unique.
That's right.
But
what will we come up with next?
So they have this little tiny special thing about their eyes, which will probably not affect them in any way. But probably their regular veterinarians will keep an eye on it also. But I don't think there's no reason to be concerned about it. It's just a little unique thing about this litter. You're busy.
Where are you going?
You're busy, Ozzy.
Where are you going, Mama? He's the most Dorothy.
See the most rambunctious?
He's very playful, but he's also pretty relaxed. So he's not in every way. But he's very smart.
Are you ready?
Yeah.
Okay. It sounds lovely.
Good job.
You're sitting up here. You like it? In the palm of my hand? Don't do that.
Oh.
I'm going to get you.
Oh, Toto, don't embarrass us in front of Dr. Ferguson. Buddy. What? Where's it? Let's find your toys. Oh, there we go. What's this? Oh, that marble out there?
Good job.
Oh, Nico's back.
Let me feel your elbows. You're showing them they work really well. Good job. And do you have 2 boys at your business?
These guys were the hardest ones I've ever had to tell to sex them when they were first born. They were all smooth.
I don't know how you can even tell. Like,
They all like this.
it really can be quite difficult. I've had breeders, like long-standing cat breeders, mess it up. So the fact that you do such a good job, I think, is great.
Oh boy, this is going to be good. Maybe we should give you a mini burrito for your.
Good boy, bud.
Oh my goodness! I'm sorry. That was so extreme.
I know. What are we doing, huh? What am I doing to Ozzy?
Oh, I was very determined right now to get some milkbar. Oh, Ozzy.
Good boy, Ozzy.
You're going well. Good job.
You're going well. I know. I'm sorry.
Nico has. Good job, buddy. Tell your brother to come back here.
I was worried she's going to pee on it.
Is she digging a hole to lay in or a hole to pee in?
Please don't pee on my paperwork.
She's been amazing. When I got her, as I was leaving, people said, oh, and by the way, she doesn't use a litter box. But she has not had a single accident since she's been here.
Maybe.
It took some convincing at first. I had to, like, really ease her into it. But she did very well. Oh,
That's
there
fine.
he is. So scampy.
99.6.
Oh, good job, buddy.
May I just move your belly? I've never had to move a belly to write on a paper before.
If you pet her, you can probably move anything.
She's letting me. She's very awesome. Thank you.
Good job, buddy. You've earned yourself a vaccine.
2 testicles, normal temperature.
Good job. He's very squirmy right now. Oh, something to smell. Yep.
Then we will get half of the demon also. Maybe I'll just eat it. What do you think? Ozzy, look at that treat. What if it moves like a toy? Get it.
Sometimes I trick them into eating kibble that way. Oh, here it is. Here it is.
The Novartis taste test. When they came out with these tablets, they're very palatable because the competition's product is actually bigger, way bigger, and doesn't have any flavored coating on it. But I find not a lot of cats will eat them, but some will. No, thank you.
Oh, all right. I'll put in your
So-
skirt.
And then just rub his throat a couple times, see if we can get him to swallow it. And then the water is really just to get him.
Oh, bad job for me.
I think I'm probably more aggressive than you. Oh, I'm sorry.
Oh my God. So much drama. Oh my goodness, buddy.
That was mean, dirty trick, huh?
Horrible.
They keep you healthy, though.
Horrible.
They'll keep you healthy.
Horrible. Did you want to keep your worms? We have one more horrible thing for you to have.
This is nothing compared to what you guys just did to me. Good boy, Toto. I was gonna jinx it and say, I don't know if we've ever had any of your kittens ever complain due to vaccines, like do a peep or anything. I think you're a good distractor and you get handled lots.
But you get some handling. Buddy, oh my goodness. You survived. Good job. Good job. Now
Are
it
you
is.
back? You will get your turn.
Now it is Manchita's turn. Let's see how much she takes.
Can I give you my room and honey break?
No, I'm good. It's just I can't put the laptop down because then they all climb on it. 675. She was the second one to start eating food, and so she's caught up quite a bit to the others, but
No, mine's cute.
from being so teeny tiny. You're so beautiful. She is so beautiful. She has a very teeny tiny little girl face. A little princess face.
Mm-hmm. So she has the most prominent persistent pupillary membrane that out of all of these guys, it's really quite interesting. But her pupil responds and acts normally. Good girl. You're so pretty. See? Ah, very good. One of the things people can do when they have a young animal is they can practice brushing their teeth and just get them used to rubbing around on their gums, primarily just the outside. They'll get a new set of teeth when they're about 6 months old. So right now, it's not necessarily about brushing these teeth. It's just getting them used to having the fingers in there and rubbing around on their gums. Because probably with them being indoor cats, one of the biggest problems that owners will face is just dental disease over hopefully the next 20 years. So if you can brush their teeth, or get them used to it, that is half the battle. That's a good one. Yeah. Good job. No potatoes. Oh. Yeah, you get it. Rhinoscopy. There you go.
Good job, Monchita. No, you stay off of it. You're troublemaker. Oh, Marty's getting attacked by Ozzy. Oh, baby. I will see.
Very lovely.
You feel your tummy okay? There you go, Monchita. Go home. Oh, so good. What are you talking to, Ozzy?
Very good. So what do you think? Are you up to it? Let me just feel your elbows.
Yeah. Oh boy, Cheetah. I think you have had your temperature taken before. This will not be your first rodeo.
We'll see if I can do it more slick this time.
Oh, what a champ. What a little
Good girl.
treasure. You are so cute.
Is she the friendliest
Which? This one?
mother cat
Oh.
you've ever had? Do you think?
No, Calypso from the
Oh,
dancers was pretty friendly. She's pretty friendly. She does like come and get in my lap when I'm working, and she's always on my feet. TK was pretty friendly too. She does the flop. She's gotten much better with her chasing and attacking. Actually, I think that seems like it was triggered by anxiety, and a little bit of I think she's gonna need to be played with. She's got a lot of energy. She's still a baby anyway.
Or her stools? Pretty good.
They're like
Come and go.
70-80%. They're definitely better than they were though. I do hear her gurgling sometimes, but it comes out pretty good. It's not. She's just loving it.
There you go. 99.9.
Yay! Good job, Manchita. You're cute.
Hey, gorgeous.
Wow, 1,449 people.
You want to see if you can convince her that this is lovely?
She might.
If not, I'll drop the vaccine in the interim. It's not for you. What do you think? Hi, Ozzy. Oh, I think you sneezed. That's not for you. She's intrigued, but not quite enough. Not quite enough. Yep. Okay. Under your paw. Under your paw. Under your paw. So just pop it in. Very good. Oh my goodness.
She says something in my mouth and I object. That is not milk.
I know. That is an interesting reaction.
Can I give you a teeny bit of water? Mm.
Oh,
Are you missing out?
Oh. She did have a bottle, so she's not like super.
Okay. Left shoulder, gorgeous.
It's time.
Good girl. Good girl.
Good job.
Nice job.
Mm-hmm.
You're so brave.
What a champ. What a little champ. What a little champ. All done. Let's see. It's time for the professor. It is 9:60.
Well, you're a big guy.
Big boy. He's not as clean. He gets
I
food in
bet.
his little nose.
Yeah. You'll get better at it when you get older, buddy. Probably. Unless you just don't care. And I've met cats that don't care as much as others, but go ahead.
What is that? Oh,
I'm two and then something. Can I try it? Just gonna Good boy. You feel that when I tickle your nose. That's good. He's got this little tufts below his eye hair.
mm-hmm.
That's awesome.
Like little lamb chops.
Yeah. Good job. That's just a mean, dirty trick. He peeks in your mouth. Huh? Looks good. And his incisors aren't pushing in on each other, which is good.
And they look like they've straightened out a bit too.
Yeah, they actually, I thought by now we might be getting into a little trouble where we had to take out some of his baby teeth, but he's doing well. You're a smart guy.
And he's got a little bit of, I don't know if this is just because his chin is always in the food, but he's got a little bit of like dark.
I think it's probably because it contacts things probably more.
Yeah.
I think you're right.
So I try to keep him clean, but I don't always get there in time.
He might end up with a little bald chin because it's going to protrude, relative to more than the others.
You're a goofball. I'm trying to see if he has what's called a menace response, whereas when you come up to somebody, they do a blinking response, but he might just be so chill that he just is like, whatever, poke me in the eye. What about with this? We'll try again in a bit. I don't want to use up all my goodwill with his head at once. He's probably used to everybody staring at his little face. Is this what it is like to be the most beautiful cat in the world? Everybody staring at my face?
And looking in his mouth and
yeah. It feels good. Let me have a listen to your little heart.
he's definitely got some pudge.
You're tuckered. He is the roundest of these guys I've felt so far. His weight is inversely proportional to your sleep, probably.
I started him off right, but now he just can't get enough of the food.
I can feel stuff way in there. You're one solid kitten. So when I was getting you to do what's called conscious proprioception and just flipping his feet over like this is that, and he does it really well. And you were doing a really good job. You probably just didn't know you did. Is that if you put their foot in the wrong place, the impulse has to travel all the way up to their brain and back down and it tells their feet that they're in the wrong place. Mm-hmm. So he's so normal in that respect that you don't even get a chance to let it sit there. Okay. He's just like, oh, you're putting it in the wrong place, and it's going back and forth so normally.
Okay, well that's good.
So I know it was hard to get him to rest because he's so normal in that respect. So the information goes out to his limbs the way that it's supposed to.
That's good.
Which is good. So does he have two boys down there? No, your knees. Make sure you have on these two. Hi, Toto.
Jesus.
We're in her wing. And I did listen to this one. You did, didn't I?
I think you did.
Good. Let me have a listen. We got off topic. It's just really that you got the cat to this stage and there was no aspiration or anything. That's really awesome.
And he's so healthy.
Amazing. Amazing, buddy.
So far, so good.
Amazing. You have a kink.
He has a kink tail. He's extra special.
You're all kinked all over at the front and the back.
And round in the middle.
Oh, get it.
should do that. I was going to tweet and then I
You like the otoscope, huh?
let go.
Well, we should grope him unless you've done.
Okay, I have not groped him.
Good job!
Yay! That was easy.
I don't have to do any crazy searching for testicles during your surgery, which is lovely.
That is good. Since you're going to be doing it live.
I'm looking forward to it. I think it'll be good. A good opportunity for people to see how well they do, what goes on behind the scenes, and how fast they recover.
Yeah.
Like,
I think that's good too. The pediatric spay neuters are so easy on them.
Yeah. The procedures are so short, they heal, they recover so quickly, and the postoperative healing is so quick that they will be eating within a couple of hours and playing in their kennel probably within about 20 minutes. So the anesthetics these days that we can use are just so safe, and we can control any potential pain before it even happens, so that they never have the opportunity to be uncomfortable. They just wake up and start playing, and then we give them a little bit of time to make sure that they're waking up, and then they get lunch.
Yep. It's like it never happened a few hours later by the time they get home. So that will be the 22nd, starting at 10 a.m. kitten time, and we will be at Mountain View Veterinary Hospital. So don't miss that. I'll be broadcasting that on a separate channel so that people who don't want to see it can watch these guys, and then people who do want to see it can watch the surgery.
Good. Beer 100.2.
Good job, buddy.
Okay. And you are still in the half a tablet also.
Mm-hmm.
Just
barely. So 10 more days, he'll probably be like 4 pounds by then.
Where are you going?
And are there any extra concerns with him, with his nose or breathing or anything?
No.
Can you see that?
I think if he had had a cleft palate, he would have, his biggest risk would have been over this past 8 weeks in eating and not aspirating. His heart is good, his lungs are good, he breathes well, his lung, I think that cardiovascular wise, he is very normal and healthy, so I can't foresee any problems.
See that?
He'll have another, they all will have another full exam on that day before we sedate them and get them ready for their surgery.
Do you see it now? He's not quite as... He's following my finger. Not to be killed. Do you see it? Ready? Look.
You get yours, Dorothy, after.
Not my finger. The pill. Go get it. Ready?
I'm going to, when we look at the next kitten, I'll do a menace response on the next one to see, because it can be hard to get a menace response on kittens, so I want to see if I can get it on another one.
Can you see it if it's high contrast black? Let's try this. Do you see it now? Here. He could just be focusing on my hand.
It's hard because they're like little toddlers, right?
Except the other kittens, though,
have, yes.
all saw the pill and went right after it.
I want the big red stethoscope.
Ready? See it. Look, get it. Oh, there you saw it.
It's not your snacky little monster.
There you saw it that time.
Oh, good boy. Now how about you eat it for it? No, thank you.
Get it. Can you see it? There you go. Here it is, right here. No. Here, look. And get it. Get it. That's a bad bounce. Whoops. Here we go. And ready? And go.
So, ready?
That was quite acrobatic. But... Buddy, look. There. No, just the carpet. He definitely tracks things, like he follows. It's just the Bible.
Are you trying to get it too?
Oh, Miss Dorothy. She's very playful.
Wonder if he's charged up, if we can try Menace now. Light up. Oh, gotcha. It's very yummy. It's very yummy. Mm.
Oh, what a good boy.
Put it to the back. Come on, Dr. Princess. Oh, I know. I kind of got it in the side there.
Oh, and back. Rejected.
I'm sorry. That was a mean, dirty trick, huh? Oh. Ready for your vaccine, mister?
Boy.
Good job.
Good job.
I know. These guys are toughies.
Mm-hmm.
Good job. Now he's all riled up.
Mm-hmm. Is it good if he's upside down?
Well, sometimes it's good because you can check for other things like called nystagmus, where their eyes move back and forth, like there's positional nystagmus, and he doesn't have that, which is lovely. Yeah, I know. I don't know whether I think whether he sees exactly as well as he's supposed to. Can you look into that a little bit more? He has a palpebral, and you feel this in your nose, and you have a swallow reflex, which is lovely. And he's not hypermetric. He doesn't exaggerate with his back.
That's good. And he has 2 white toes.
And tons of kitty spirit.
That's right. Yes.
You might just be a little extra special.
All right. Let's see. We've got, I think, just Nico left.
That would make sense with what I have also.
Okay.
I have 2 vaccine photos.
That's Ozzy. Oh, this is Nico right here.
Sleeping. Hi, buddy.
Oh, you need to wait. $9.20.
Nice.
Big boy.
Hi, sweetie. How are you?
He has a silvery brisket.
I saw that. It's very lovely. More so than Ozzy, and he's a bit bigger, right? Yeah.
Yeah.
Can I try this with you? See, we can compare you to Marvel. See, I think it's a hard thing in cats, especially kittens. You're so neat. Let me check your teeth out. Oh, you're just getting your little nubs of incisors. Oh, very good. So when you're looking in the mouth, I'm looking for the occlusion of their teeth, that they're coming in the way they're supposed to be, that they seemingly to have the right amount of baby teeth, and also that I'm not seeing any inflammation in their mouth, which can be a sign of viruses. And I'm not seeing any of that, which is great. Oh, get it. Good job. His ears, I don't expect to see any problems in these guys' ears because Dorothy's had revolution, which helps get ear mites. And that's how the kittens would get ear mites. And also they just have normal ear canals. Good job. Make sure your lymph nodes are good. You're so beautiful, Nico. Good. Can I listen to your heart now? I know, buddy. I'm gonna get more toys. I didn't put very many toys back in after I vacuumed.